evening. This is All India Radio Kohima. I'm Nabin Pradhan with the evening news, and these are the headlines. Health Ministry issues SOP on COVID-19 containment and management in peri-urban, rural and tribal areas. Chief Secretary J. Alam holds comprehensive review of COVID-19 situation in Nagaland. Centre urges states and union territories to ensure exemption to fair price shops from restricted hours, and online appointments for second dose of Covishield to be given only after 84 days. As the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. Union Health Ministry has issued standard operating procedure on COVID-19 containment and management in peri-urban, rural and tribal areas. The ministry said a large number of cases of COVID-19 are reported in urban areas. However, a gradual increase is now being seen in peri-urban, rural and tribal areas as well. In view of this, there is a need to enable communities strengthen primary level healthcare infrastructure at all levels to intensify COVID-19 response in these areas. Health Ministry said nearly 80 to 85% COVID-19 cases are asymptomatic and or mildly symptomatic, and they do not require hospitalization and may be managed at home or in COVID care isolation facilities. Monitoring of oxygen saturation is important for monitoring of COVID patients. For this, it is desirable for each village to have adequate number of pulse oximeters and thermometers. The ministry said home isolation kit shall be provided, which includes required medicines such as paracetamol 500 mg, tablet ivermectin, cough syrup, multivitamins, besides a detailed pamphlet indicating precautions to be taken and medication details. Patients under home isolation will stand discharged and end isolation after at least 10 days have passed from the onset of symptoms and no fever for 3 days. There is no need for testing after home isolation period is over. The ministry said peri-urban and rural areas may plan a minimum of 30 bedded COVID care centers which will offer care for asymptomatic cases with comorbidities or mild cases where home isolation is not feasible. It could admit a COVID suspect or confirmed case. Chief Secretary J. Alam today held a comprehensive review of COVID-19 situation in Nagaland at the State War Room in the presence of senior officers. The meeting discussed on availability of oxygen and augmentation, bed availability and installation of PSA oxygen plants in various district hospitals. The Chief Secretary appealed to all the citizens not to panic and stay safe following all COVID-appropriate behavior. In view of the ongoing lockdown, the government has requested states and union territories to ensure that fair price shops are exempted from the restricted hours of opening of regular market. Department of Food and Public Distribution has issued an advisory to all states and union territories to keep the fair price shops open, preferably on all days of the month, and distribute food grains to beneficiaries in a staggered manner throughout the day. The ministry said this will ensure that food grain under Pradhan Mantri Garib Kalyan Anna Yojana 3 and NFSA will be made available to all beneficiaries in a safe and time-bound manner, duly observing COVID-19 protocols. Last month, the centre had announced to provide free food grains for the month of May and June to nearly 80 crore beneficiaries under the scheme. The government has said that the online appointments for second dose of Covishield will be given only after 84 days. Previously booked appointments for second dose of COVID vaccine will remain valid. However, those who wish can reschedule their existing appointments to after 84 days. In a letter to health secretaries of states and union territories, Additional Secretary in the Health Ministry Vikas Shields said further online or on-site appointments will not be possible if the period after the first dose date for a beneficiary is less than 84 days. You're listening to the news from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel AIR News Kohima. The Health Ministry has informed that in the last 24 hours, the nation registered 311,170 new COVID cases. It informed that 4,077 COVID-related deaths were reported in the last 24 hours, taking the cumulative toll to 2,70,284. So far, over 2 crore 7 lakh people have recovered from the COVID-19 infection in the country. The country has administered more than 18 crore 22 lakh doses of COVID-19 vaccine so far. The government continues to expeditiously deliver the global aid received from different countries and organizations to states, unions, and territories to supplement their resources and efforts in fight against COVID-19. Over 11,000 oxygen concentrators, more than 13,000 oxygen cylinders, 19 oxygen generation plants, and 5.3 lakh remdesivir vials were dispatched through road and air from 27th April to 15th May. India has been receiving international donations and aid of COVID-19 relief medical supplies and equipment since 27th April from different countries and organizations. Major consignments received in the last 2 days are from Kazakhstan, Japan, Switzerland, Canada, the US, Egypt, and British Oxygen Company of the UK. The centre has announced supply of vital antiviral drug remdesivir to states, unions, and territories. After issuing the revised supply plan today, Union Chemical and Fertilizers Minister Sadanand Gowda said that considering the requirement of remdesivir in various states and union territories and to ensure its adequate availability, substantial increase has been made in its overall production and allocation. He affirmed that the increased supply of the vital drug will help in fighting the pandemic with deeper resolve. Under the revised supply plan, the allocation for states like Delhi, Maharashtra, Karnataka, Chhattisgarh, and Gujarat, among others, have been considerably enhanced. The Indian Railways has commissioned Wi-Fi at 6,000 railway stations in 5 years. The Railway Ministry said Indian Railways continues to contribute to Digital India initiative and connect different parts of the country with high-speed Wi-Fi facility. This will bridge the digital divide between the rural and urban citizens, thereby increasing the digital footprint in the rural villages and also enhance the user experience. With the commissioning of Wi-Fi at Hazaribagh railway station in Jharkhand on Saturday, Indian Railways commissioned Wi-Fi at 6,000 railway stations. The ministry said Railways have started its journey by providing Wi-Fi facility at First Railway Station Mumbai in January 2016. The government has asked people not to share pictures and contact details of vulnerable children in distress situation in the social media. Their identity is to be protected as per law. Women and Child Development Minister Smriti Irani has said the Police Child Welfare Committee or Childline 1098 should be informed if anyone comes to know of any child who has lost both parents to COVID and has no one to take care of them. She said legal adoption of such children must be ensured, otherwise children can be trafficked in the name of adoption. It is illegal to give or take orphan children of anyone else in adoption. If anyone contacts someone regarding orphan children available for direct adoption, they must be stopped as this is illegal. And to end the news, a reminder of the headlines. Health Ministry issues SOP on COVID-19 containment and management in peri-urban, rural and tribal areas. Chief Secretary J. Alam holds comprehensive review of COVID-19 situation in Nagaland. Centre urges states and union territories to ensure exemption to fair price shops from restricted hours and online appointments for second dose of Covishield to be given only after 84 days. And that's all the news we have for you this evening. Good night.